Question 1. A group of dogs has been introduced into a new shelter and some of them appear to be displaying stress behaviors such as excessive barking, pacing, and showing signs of fear when approached by humans. The shelter manager is concerned about the well-being of these animals and is unsure how to proceed with managing their stress. What should the shelter manager do to ensure the dogs' welfare while minimizing their stress? A. Allow the dogs to interact freely with each other. 2. Settle in naturally and avoid any interference from staff. B. Remove the dogs from the new environment and return them to their previous shelter to avoid the stress of the new surroundings. C. Gradually acclimatize the dogs to the new shelter environment by providing structured interaction, quiet spaces, and monitored socialization with staff members. D. Administer anti-anxiety medications to dogs to prevent any signs of distress from occurring. Answer C. Explanation. In the situation of dogs displaying signs of stress after a move to a new shelter, it is critical to understand their behavior and offer gradual and structured support. Allowing the dogs to interact freely, option A, can overwhelm them and exacerbate the problem. Moving them back to a previous shelter, option B, may not be beneficial as they will likely encounter similar stresses again without addressing the underlying causes. Administering medications, option D, without behavioral assessment is not a recommended first step as it does not address the source of the stress and could create additional complications. Gradually acclimatizing the dogs, option C, provides them with time to adjust and allows staff to monitor their reactions, providing controlled, positive exposure to the environment. This approach helps reduce stress and builds trust with the animals, leading to better welfare outcomes. Question 2. What is the most important consideration when selecting and using equipment for restraining an animal for transport? A. The equipment should be the cheapest and most readily available option. B. The equipment must be designed to fit the specific species and size of the animal, ensuring safety and comfort. C. The equipment should be chosen based solely on personal preference and convenience. D. The equipment should be lightweight to ensure ease of use for the handler. Answer B. Explanation. Selecting proper restraint equipment is essential to ensuring both the animal's safety and the handler's safety. Option A. Choosing the cheapest option disregards the necessity for safe and appropriate equipment for each species and individual animal. Option C does not prioritize animal welfare or safety, which is the primary goal when handling animals for transport. While ease of use is important, option D, it should not come at the expense of ensuring the equipment is appropriate for the animal's size and needs. Option B is the correct answer because choosing species and size-specific restraint equipment guarantees that the animal is securely confined, minimizing stress and preventing injury. Proper equipment ensures that the animal is comfortable during transport and helps the handler maintain control during the process. Question 3. Scenario. Mr. Thompson, a farm worker, notices that one of the sheep has been injured in the pasture. The sheep is limping and seems to be in pain. Mr. Thompson is unsure about the severity of the injury and whether he should intervene or wait for a veterinarian. What should Mr. Thompson do? A. He should wait until the next scheduled veterinary visit and observe the sheep to see if it improves. B. He should immediately apply first aid by cleaning the wound and applying bandages without consulting a professional. C. He should assess the severity of the injury, provide basic first aid if necessary, and contact a veterinarian for further advice. D. He should move the sheep to a different pasture to reduce the risk of further injury and wait veterinarian. Answer C. Explanation. When dealing with an injured animal, it's important to assess the situation carefully. Option A is not recommended because waiting for the scheduled veterinary visit could allow the injury to worsen, especially if it is a serious one. Option B suggests applying first aid without professional consultation, which may not be the most appropriate response depending on the injury's nature. While applying basic first aid, such as cleaning the wound, is essential, it must be done carefully to avoid causing further harm. Contacting a veterinarian for further guidance, option C, is the most responsible course of action, ensuring that any further steps are based on expert advice. Option D, moving the sheep to a different pasture, does not address the injury itself and might not prevent further harm. Correct handling and the involvement of a professional are key to ensuring the sheep receives proper care. Question 4. Which of the following is the most appropriate method for assessing whether an animal is experiencing pain? A. Observing the animal's vocalizations alone. B. Monitoring the animal's physical movements and body posture. C. Checking the animal's temperature and heart rate regularly. D. Evaluating the animal's food and water intake levels only. Answer B. Explanation. While vocalizations, option A, can be a sign of pain, they alone are not sufficient for determining if an animal is in pain. Temperature and heart rate, option C, can be indicators of stress or illness, but they are not direct indicators of pain. Monitoring food and water intake, option D, could suggest an animal's health status, but it doesn't directly reflect pain levels. The most effective way to assess pain is closely observing physical movements and body posture, option B. Animals in pain often change their posture, become more immobile, or show signs of discomfort when moving. This provides more comprehensive understanding of the animal's pain status as it relates directly to how they are physically responding. Question 5. When working with livestock, what is the primary consideration when selecting handling equipment? A. The equipment should be chosen based solely on the cost. B. The equipment should be designed to minimize injury to both the handler and the animal. C. The equipment should be visually appealing and match the handler's personal preference. D. The equipment should only be chosen for its effectiveness in controlling the animal's movement. Answer B. Explanation. While cost, option A, and appearance, option C, may influence the selection process, they are not the primary factors when choosing equipment for livestock handling. Option D focuses on controlling movement, but it overlooks the importance of minimizing injury. The correct approach is to choose equipment that minimizes the risk of injury to both the handler and the animal. Option B. This includes considering the size and species of the animal, the type of handling required, and the comfort and safety of the animal during restraint. Properly designed equipment helps ensure that the animal is not unnecessarily stressed, harmed during handling. Question 6. Scenario: MS. Collins, an animal handler, is preparing to transport a group of horses to the veterinary clinic. The horses are nervous and some are showing signs of restlessness. What should MS. Collins do to ensure the horses are transported safely and with minimal stress? A. Secure the horses tightly in their transport crates and drive quickly to minimize the time spent in transit. B. Provide the horses with ample space in the transport vehicle to allow for free movement and minimize restraint. C. Ensure the horses are securely tied and cannot move excessively, but are comfortable during the trip, taking regular breaks during transport. D. Sedate all of the horses to prevent any signs of stress from occurring during journey. Answer C. Explanation. When transporting animals, it is important to ensure their safety and minimize stress. While driving quickly, option A, may seem like an efficient approach, it can actually increase stress for the animals and may lead to accidents. Allowing free movement, option B, may cause further restlessness or injury during the transport. Sedating the horses, option D, should only be done under professional guidance, as sedatives may have effects and are not a first-line solution. The most appropriate option is C, where the horses are securely tied without excessive restraint and regular breaks are provided to allow them to rest and hydrate. This minimizes stress while ensuring they are safely secured. Question 7. Which of the following is a key factor when designing an animal enclosure to ensure the safety and welfare of the animals? A. The enclosure should provide sufficient space for the animal to exhibit natural behaviors, such as roaming or nesting. B. The enclosure should be made of materials that are inexpensive and easy to maintain, regardless of durability. C. The enclosure should be designed to prioritize ease of access for human workers without consideration of animal needs. D. The enclosure should be small to limit the animal's movement, making it easier to manage. Answer A. Explanation. Designing an enclosure with enough space to allow animals to exhibit natural behaviors, option A, is essential for their physical and mental well-being. Option B may focus on cost and maintenance but neglects the durability and safety of materials, which are critical to preventing harm. Prioritizing human access, option C, without considering the animal's needs could compromise their comfort and welfare. Limiting movement, option D, is detrimental to the animal's health, as restrictive enclosures can lead to stress, frustration, and behavioral issues. The correct approach is to design enclosures that support the animal's needs and welfare while ensuring safety. Question 8. What is the primary concern when administering basic first aid to an injured animal? A. Ensuring the injury is cleaned and covered before calling a veterinarian. B. Keeping the animal calm and preventing further injury while waiting for professional help. C. Immediately administering pain relief medication without consulting a veterinarian. D. Allowing the animal to rest for an extended period of time to recover. Answer B. Explanation. When administering first aid to an injured animal, the primary concern is to keep the animal calm and prevent further injury. Option B. This includes ensuring that the animal is safely restrained and that any movements that might aggravate the injury are minimized. While cleaning and covering the injury, option A, is part of first aid, it is essential to prioritize stabilizing the animal and ensuring that professional help is on way. Administering pain relief, option C, without professional consultation could lead to complications, especially if the injury is serious. Allowing rest, option D, is beneficial, but only after stabilizing the injury and seeking professional help. Question 9. Scenario. Mr. Harris is working in a farmyard and notices that one of the cows has been exhibiting unusual behavior such as avoiding food and acting lethargic. After inspecting the animal, Mr. Harris suspects the cow may be ill. What should Mr. Harris do next? A. He should immediately separate the cow from the rest of the herd and monitor it for further signs of illness. B. He should try to diagnose the cow's illness himself and administer treatment without seeking outside help. C. He should call a veterinarian for a professional diagnosis and follow their advice regarding treatment. D. He should continue to monitor the cow in the herd and avoid taking any action unless the symptoms worsen. Answer. C. Explanation. When suspecting that an animal may be ill, the best course of action is to contact a veterinarian for a professional diagnosis. Option C. Self-diagnosing and administering treatment, option B, could lead to incorrect treatment and worsening of the animal's condition. While isolating the animal, option A, may be appropriate to prevent the spread of any contagious illness, it is equally important to get a diagnosis from a veterinarian before deciding on further action. Monitoring the cow without intervention, option D, could allow the condition to worsen, making early intervention crucial to the animal's health. Question 10. Which of the following is the most effective way to reduce stress when handling aggressive animals? A. Use forceful restraint methods to control the animal quickly. B. Allow the animal to calm down on its own without attempting any handling. C. Use positive reinforcement techniques to encourage calm behavior and reduce fear. D. Avoid any physical contact with the animal and rely solely on verbal commands. Answer. C. Explanation. Using positive reinforcement, option C, is the most effective method for reducing stress in aggressive animals. This involves rewarding calm behavior, which encourages the animal to relax and respond positively to the handler's presence. Forceful restraint, option A, can escalate the animal's aggression and increase stress, while allowing the animal to calm down on its own. Option B may not be effective in all cases. Solely on verbal commands, option D, might not be sufficient to handle aggressive animals safely. Positive reinforcement provides calm, controlled environment that helps the animal feel more secure and less stressed during handling. Question 11. When is it appropriate to use sedation when transporting an animal? A. Only when the animal has been assessed by a veterinarian and sedation is necessary for the animal's well-being during the journey. B. Whenever the animal shows signs of distress, even if no veterinarian is available. C. To ensure the animal remains completely still for the entire duration of the transport. D. Whenever the handler is unable to manage the animal's behavior during transport. Answer. A. Explanation. Sedation should only be used when necessary and after a professional assessment. Option A. Sedating animals without veterinary oversight could lead to complications or health risks, especially if the animal has underlying conditions. Using sedation when there are no signs of distress, option B, is not appropriate, as unnecessary sedation can be harmful. The goal of sedation is not to keep the animal completely still, option C, but alleviate stress in certain situations where it is deemed medically necessary. Using sedation for convenience, option D, is also inappropriate. It should be considered only when other handling techniques are ineffective and when guided by a veterinarian. Question 12. Which of the following is the most important consideration when choosing an animal's diet in a farm or ranch setting? A. The animal's dietary preferences based on its past feeding habits. B. The animal's specific nutritional needs, including its species, age, and health status. C. The availability of cheap feed options, regardless of their nutritional value. D. The farm's ability to purchase large quantities of feed at a discount. Answer. B. Explanation. The most important consideration when choosing an animal's diet is ensuring that it meets the animal's specific nutritional needs. Option B. This includes understanding the species, age, health status, and any special dietary requirements such as those for lactating or pregnant animals. While dietary preferences, option A, can influence feed choices, they should not override the animal's nutritional needs. The availability, cheap feed options, option C, or discounts on bulk purchases, option D, may seem cost-effective, but they can compromise the quality of the animal's nutrition, leading to health issues in the long term. Question 13. Scenario. Mr. Franken is transporting a dog to the veterinary clinic, and the dog begins to show signs of anxiety, such as panting, pacing, and drooling. What is the most appropriate response to reduce the dog's stress during transport? A. Administer sedative to calm the dog immediately. B. Continue driving without taking any action, as the anxiety will subside after a short period. C. Provide safe, calm environment by covering the transport crate using calming scents or music and ensuring the dog is securely positioned. D. Open the crate door to allow the dog to move around, hoping it will calm down on its own. Answer C. Explanation. Providing a calm, secure environment. Option C is the most appropriate response to reducing stress in a dog during transport. This can involve covering the crate to reduce visual stimuli, using calming scents or music, and ensuring the dog is properly secured to prevent further anxiety. Sedation, option A, should only be done under the guidance of a veterinarian and is not typically the first option for anxiety. Allowing the dog to move freely, option D, may increase anxiety and lead to further stress. Simply continuing the journey without addressing the issue, option B, may exacerbate the dog's anxiety. Question 14. Which of the following actions is most effective for ensuring proper biosecurity on a farm? A. Allowing all visitors to freely access animal areas without restrictions. B. Providing staff with proper training on hygiene practices and ensuring they use protective equipment when handling animals. C. Using chemical disinfectants to sterilize the farm area only once a year. D. Limiting the number of animals on the farm to avoid the spread of disease. Answer B. Explanation. Proper biosecurity. Option B includes regular hygiene practices and ensuring that staff are properly trained and equipped to minimize the spread of disease. This can include washing hands, wearing gloves, and using protective gear when handling animals. Allowing unrestricted access, option A, poses a risk of disease transmission from visitors. Relying on annual disinfection, option C, is not effective as biosecure. Measures should be continuous. Limiting the number of animals, option D, can reduce the risk of disease, but is not a comprehensive solution to ensuring biosecurity. Question 15. Which of the following is the best approach to handling an animal that has been injured and is in a state of shock? A. Administer pain relief medications immediately, regardless of whether a veterinarian is available. B. Attempt to move the animal to a more comfortable location before assessing the injury. C. Keep the animal warm, calm, and as still as possible while waiting for professional help. D. Allow the animal to move around freely to prevent further injury. Answer C. Explanation. When an animal is in shock, it is critical to keep it warm, calm, and still to prevent exacerbating the condition. Option C. Moving the animal, option B, could worsen the injury or stress the animal further. Administering pain relief, option A, without professional advice can be risky and should only be done if guided by a veterinarian. Allowing the animal to move freely, option D, may worsen the injury and increase the other harm. Stabilizing the animal while awaiting professional care is the safest and most effective approach. Question 16. Scenario. MS. Roberts is caring for a sick cat that refuses to eat or drink. The cat is lethargic and has not responded to any of the usual treatments. What is the best course of action? A. Wait for the cat to recover on its own, as many illnesses resolve without treatment. B. Continue administering the same treatments and assume the cat will eventually improve. C. Contact a veterinarian immediately for further evaluation and a potential change in treatment. D. Administer over-the-counter medications to the cat to improve its appetite. Answer C. Explanation. When an animal refuses to eat or drink and shows signs of lethargy, it is essential to seek professional help. Option C. This could indicate a serious underlying health issue that requires specialized care and possibly a change in treatment. Waiting for the cat to recover on its own, option A, or continuing with the same treatment, option B, may delay the necessary intervention. Administering over-the-counter medications, option without professional guidance can be harmful, as some medications can be toxic to animals. Immediate consultation with a veterinarian is crucial to ensure the cat's health is properly addressed. Question 17. Which of the following actions is most appropriate when handling an animal that is displaying aggressive behavior? A. Approach the animal quickly to subdue it before it escalates. B. Attempt to restrain the animal immediately using force. C. Remain calm, assess the situation, and use gradual movements to create distance. D. Ignore the animal's behavior as it is likely just a temporary display of aggression. Answer: C. Explanation. The correct approach is to remain calm, assess the situation, and use gradual movements to create distance. Option C. Aggressive animals are often stressed, and sudden movements can provoke further aggression. Approaching quickly, option A, or using forceful restraint, option B, can escalate the aggression and put both the handler and the animal at risk. Ignoring the behavior, option D, is not advisable because it may lead to safe situations for both the animal and people around it. A measured response helps maintain control and minimizes harm. Question 18. Scenario: Mr. Henson works at an animal shelter and notices a dog showing signs of severe dehydration such as dry gums, sunken eyes, and lethargy. What should Mr. Henson do first? A. Attempt to give the dog a large amount of water all at once. B. Leave the dog to rest and monitor it until it shows signs of recovery. C. Contact a veterinarian for advice and give small amounts of water or an electrolyte solution if instructed. D. Take the dog for a walk to encourage it to drink water on its own. Answer: C. Explanation. When an animal is severely dehydrated, as indicated by dry gums, sunken eyes, and lethargy, it is crucial to contact a veterinarian. Option C. For advice and possibly administer small amounts of water or an electrolyte solution as instructed. Giving the dog a large amount of water, option A, could cause further issues such as vomiting or aspiration. Leaving the dog to rest without intervention, option B, worsen the dehydration. Encouraging the dog to walk, option D, may further stress it and prevent hydration. Question 19. What is the primary purpose of animal enrichment in captivity? A. To make animals perform tricks for the entertainment of visitors. B. To mimic the natural environment and stimulate the animal's mental and physical activity. C. To make the animal's enclosure look aesthetically pleasing. D. To keep animals isolated from human interaction to reduce stress. Answer: B. Explanation. The primary purpose of animal enrichment, option B, is to mimic the animal's natural environment, stimulating both mental and physical activity. This helps prevent boredom and stress, contributing to better welfare. While it is essential to maintain aesthetically pleasing enclosures, option C, the primary goal of enrichment is the animal's well-being. Enrichment does not involve making animals perform tricks. Option A. No. Isolation from human interaction generally recommended. Option D, as social interaction can be beneficial for some species. Question 20. Which of the following is an essential component of effective animal handling for transport? A. Using the smallest possible transport container to save space and reduce costs. B. Ensuring the animal has access to food and water only at the final destination. C. Securing the animal appropriately within the transport vehicle to minimize movement and prevent injury. D. Allowing animals to travel without supervision to avoid causing them stress. Answer: C. Explanation. Securing the animal appropriately within the transport vehicle, option C, is essential for minimizing movement and preventing injury during transport. The animal should be in a well-ventilated, spacious, and secure transport container with sufficient space to stand and move comfortably, reducing stress and injury risks. Using a small transport container, option A, can lead to discomfort and stress. Animals should have access to food and water during transport, option B, if needed, especially for longer trips. Supervision, option D, is also necessary to ensure the animal's safety and welfare during travel. Question 21. Which of the following is an example of a zoonotic disease? A. Canine parvovirus. B. Feline leukemia virus. C. Tuberculosis TB. D. Kennel cough. Answer: C. Explanation. A zoonotic disease is one that can be transmitted between animals and humans. Tuberculosis (TB), option C, is a zoonotic disease that can be transmitted from infected animals to humans, particularly in high-risk environments such as farms or wildlife settings. Canine parvovirus, option A, and feline leukemia virus, option B, are specific to their respective species and are not zoonotic. Kennel cough D is a respiratory illness in dogs and is not transmissible to humans. Zoonotic diseases require special precautions to protect handlers and the general public. Question 22. What is the best way to assess the behavior of an unfamiliar animal before attempting to handle it? A. Observe the animal from a distance to gauge its body language and vocalizations. B. Approach the animal directly and begin handling it gently. C. Allow the animal to come to the handler to assess its trustworthiness. D. Immediately use a leash or collar to control the animal's movements. Answer A. Explanation. The best way to assess an unfamiliar animal's behavior is to observe it from a distance. Option A. To gauge its body language and vocalizations. This helps determine if the animal is relaxed, fearful, or aggressive, allowing the handler to decide on the best approach. Approaching the animal directly, option B, could provoke a negative response or increase the animal's stress, allowing the animal to come to the handler. Option C may not. Effective, especially in new or stressful environments. Using leash or collar immediately. Option D, without assessing the animal's behavior, could lead to resistance or aggression. Question 23. Scenario: Jane works at a veterinary clinic and has just received an animal with a possible broken limb. The animal is visibly distressed and aggressive. What is the first step she should take? A. Immediately attempt to sedate the animal to calm it down. B. Attempt to restrain the animal with force to prevent it from hurting itself. C. Use a calm, slow approach and assess the situation before deciding on the appropriate restraint or care methods. D. Leave the animal alone until it calms down on its own. Answer C. Explanation. In this situation, Jane should use a calm, slow approach, or option C, and assess the situation first. The animal's behavior needs to be evaluated before determining the best restraint or care method. Attempting to sedate the animal, option A, or using forceful restraint, option B, can increase stress and cause further injury. Leaving the animal alone, option D, could worsen the situation as the animal may hurt further. A measured, calm approach is crucial to prevent escalation and ensure the animal's safety. Question 24. Which of the following is a common sign that an animal may be experiencing stress during handling? A. Relaxed body posture and wagging tail in dogs. B. Purring and rubbing against the handler in cats. C. Hissing and lunging in cats or biting in dogs. D. Eating and drinking enthusiastically. Answer C. Explanation. Stress in animals during handling is often indicated by aggressive behaviors such as hissing, lunging in cats, or biting in dogs. Option C. These are clear signs of discomfort or fear. Relaxed body posture and wagging tail, option A, usually indicate comfort and happiness in dogs, while purring and rubbing against the handler, option B, is generally a sign of contentment in cats. Eating and drinking enthusiastically, option D, does not necessarily indicate stress, as animals may continue to eat in stressful environments, but this does not directly reflect their emotional state. Question 25. Which of the following is the most appropriate way to handle an animal that is frightened and trying to escape? A. Chase after the animal to quickly catch it and prevent it from escaping. B. Gradually move closer to the animal and use calming techniques such as speaking softly or offering treats. C. Leave the animal to calm down on its own, as forcing interaction may worsen the situation. D. Immediately restrain the animal using a leash or cage without considering its fear level. Answer B. Explanation. When an animal is frightened and trying to escape, it is most appropriate to gradually move closer and use calming techniques such as speaking softly or offering treats. Option B. This helps reduce stress and build trust without escalating the animal's fear. Chasing after the animal, option A, could cause further panic and make the situation worse. Leaving the animal alone, option C, is not advisable because it may continue to stress and injure itself. Restraining the animal too quickly, option D, without considering its fear level, could increase the animal's anxiety and lead to further resistance or injury. Question 26. What is the main purpose of risk assessment when handling animals? A. To ensure that the animal is properly trained before handling. B. To identify and manage potential hazards that could harm the animal, handler, or others. C. To determine the best time of day for animal handling activities. D. To measure the animal's size and strength for transport purposes. Answer B. Explanation. The main purpose of risk assessment, option B, is to identify and manage potential hazards that could harm the animal, handler, or others. This involves evaluating the environment, equipment, and the animal's behavior to ensure safety during handling. While training the animal, option A, is important, it is not the primary purpose of risk assessment. Determining the time of day for handling, option C, and measuring the animal transport, option D, may be relevant, but they are not the main focus of risk assessment. Question 27. Which of the following is a crucial consideration when transporting animals in a vehicle? A. Ensuring the animal is in an open crate for better airflow and freedom. B. Securing the animal's transport container to prevent movement during transit. C. Feeding the animal just before transportation to prevent hunger. D. Allowing the animal to roam freely in the vehicle for comfort. Answer B. Explanation. The most important consideration when transporting animals in a vehicle is to secure the animal's transport container to prevent movement during transit. Option B. This helps avoid potential injuries to the animal due to abrupt stops or turns, while airflow, option A, and comfort are important. An open crate can compromise the animal's safety. Feeding the animal just before transportation, option C, is not recommended, as it could lead to motion sickness or discomfort. Allowing the animal to roam freely, option D, in the vehicle is unsafe and increases the risk of accidents or injury. Question 20 scenario. Sarah is tasked with restraining an aggressive dog at an animal shelter. The dog has been barking loudly and lunging at staff. What should Sarah do to safely restrain the dog? A. Use the muzzle immediately to prevent biting and restrain the dog as quickly as possible. B. Approach the dog with a calm demeanor, using positive reinforcement and attempt to leash the dog once it is calm. C. Restrain the dog with a leash as soon as possible, regardless of its behavior. D. Leave the dog alone until it calms down, as this may reduce aggression. Answer: B. Explanation. When handling an aggressive dog, Sarah should approach the dog with a calm demeanor, option B, and use positive reinforcement to help it relax before attempting to leash or restrain it. It's essential not to rush the process or force the dog into a restraint situation while it is in an aggressive state. Using muzzle, option A, might be valid approach in some situations, but should only be done after assessing the dog's behavior. Potential risks. Restraining the dog too quickly, option C, without first calming it can escalate aggression, and leaving the dog alone, option D, may result in missed opportunities to safely handle the situation. Question 29. Which of the following is a sign that an animal may be in pain? A. Excessive grooming and licking of a specific area of the body. B. Relaxed posture and interest in surroundings. C. Aggressive behavior and sudden changes in temperament. D. Increased vocalizations and social behaviors. Answer: C. Explanation. Aggressive behavior and sudden changes in temperament, option C, are common signs that an animal may be in pain. Animals in pain may lash out due to discomfort or fear. Excessive grooming or licking of a specific area, option A, is also a potential sign of pain, but may be more indicative of skin irritation or injury rather than general pain. A relaxed posture and interest in surroundings, option B, are signs of comfort, not pain. Increased vocalizations and social behaviors, option D, may indicate stress or attention seeking, but they are not specific indicators of pain. Question 30. Which of the following is an important factor in maintaining animal hygiene in an enclosure? A. Providing bedding that can be easily changed and cleaned to reduce bacterial growth. B. Limiting the number of animals in an enclosure to minimize cleaning time. C. Using only natural, non-chemical cleaning products to clean the enclosure. D. Cleaning the enclosure only when it starts to smell to avoid unnecessary disruption. Answer: A. Explanation. Providing bedding that can be easily changed and cleaned, option A, is crucial for maintaining animal hygiene in an enclosure. Regular cleaning and changing bedding help reduce the buildup of bacteria and other pathogens that can negatively impact animal health. Limiting the number of animals in an enclosure, option B, might reduce cleaning time, but it is not a solution to hygiene issues. While natural cleaning products, C, may be preferable, it is the cleanliness and frequency of cleaning that matter most. Cleaning only when the enclosure smells, option D, is insufficient, as it may allow harmful bacteria to accumulate and affect animal health.